Hello, my friends. In today's session, I want to take a deeper dive into my recent book, Mindful MD, 6 Ways Mindfulness Restores Your Autonomy and Cures Healthcare Burnout. I'm going to share a little bit about what motivated me to write this book, and then I want to take a deep dive into the second way that mindfulness can really help you with a lot of things that you may be struggling with in the current healthcare environment. So we're going to walk through that second way, and we're also going to talk about some practical strategies that you can use when you leave this session. So I think most of you know me by now, Dr. Gail Gazelle, former hospice doc, who pivoted 13 years ago, and I became a coach to help burnt out physicians get what they need to thrive in their careers and not hand over their happiness to what can only be described as a broken healthcare system. And along the way, I became a certified mindfulness meditation teacher. I had the privilege of doing a 2-year in-person immersive mindfulness training with 2 absolutely wonderful mindfulness educators, Jack Cornfield and Tara Brock. And I've gone on to sit multiple silent retreats. I've done a lot of different learnings. And as you know, I've done a lot of writing about mindfulness. So why did I write this book? Well, I wrote this book because I've seen mindfulness in action. I've seen the power that it has to help us regain the one type of autonomy that we all have access to, which is the autonomy over ourselves, the autonomy over our own minds. We can't always control how much autonomy we have externally. Certainly in healthcare, much autonomy has been wrested, not just from physicians, but from nurses, from therapists, from everyone in healthcare, and possibly even from patients. That's a battle that we may not win. I hate to say it. Doesn't mean we can't try, but the type of autonomy that each of you can have is the autonomy over your mind. It's becoming the master of your mind rather than what many of us live with, which is being its captive. And that's what I've seen in action in the well over 500 physicians that I've coached over the past decade, and certainly what I've seen for myself. I spent about 5 years writing this book, pulling together vignettes from the physicians that I've really had the pleasure and privilege of coaching, where I've seen mindfulness in action be a game changer for them. And I include dozens of these vignettes in the book. In a prior lesson, I talked about the first way that mindfulness restores your autonomy and cures burnout, and that is recognizing that you're not your thoughts. What I want to do today is take a deep dive into the second way, which is stepping out of mental stories. Mental stories, you know, the mind is so busy producing thought upon thought upon thought, right? 6,000 to 20,000 thoughts in an average day. A crazy number per hour, and I think many of us top that 20,000. I know I probably do with my busy physician mind. And what are all these thoughts? Well, when we pay attention, those thoughts are worries and fears and preoccupations and planning and rehearsals. There's something different than the actual experience of what's in front of us, all the judgments that the mind is so busy making. Well, all those thoughts get glommed together and aggregate into mental stories. Stories that we have, narratives that we have about ourselves, about those who we interact with, about our circumstances, about the world around us, about the planet, just about everything. And because of the negativity bias, so many of our thoughts take us in a downward direction. Really, when you stop and pay attention to your own mind, you begin to see just how unhelpful and how anxiety-producing so many of your thoughts are. When those thoughts come together into stories, well, guess what? Those stories are not typically uplifting. They're stories of gloom and doom. They're stories of inadequacy. They're stories of worry and fear and what's going to happen next. And you may have noticed that the mind is not always a great predictor of what the future holds. Really, when you stop and think about all the time you spent in worries about a future that actually never occurs. So let's take a deeper dive. What are some of these stories, certainly that occupy the minds of many physicians and others? not just physicians. But some of the stories are about personal inadequacy. I've never been as smart as, I'm not as good as, I'm not as compassionate as, they only let me in because. I've heard that one many times. I'm not as efficient. I'm not as articulate. I'm not as good as giving presentations. I'm some kind of phony. And believe me, the imposter syndrome is simply a story that the mind is producing that we become very seduced by and we begin to believe. So I want to give you a few more deeper dive examples of what I mean by stories, and a couple of these come from the Mindful MD book. So the first one is what I describe in that second way. And I describe the case of a physician who I call Diana, an early to mid-career endocrinologist who went into her specialty because of the combination of science and caring that it provided. She was fascinated by all the hormonal pathways. But 8 years into her practice, she was bored. She was bored of all the cases of obesity and mild thyroid disorders and diabetics cheating on their diets and wanting, the latest and greatest med that they could take. And she came to coaching really depleted, really worn down, burnt out. And she said to me, Gail, it's all boring, tedious, and meaningless. That's what she said to me. So sad, so tragic that that's how she felt. She said, I go through my days and it's just boring, tedious, and meaningless. Nothing I do matters. I tell my patients they need to lose 10 pounds, and what happens? They come back 15 pounds heavier. I tell them they need to stick to their diabetic diets, but do they? No. She was really defeated and deflated by the lack of compliance for all of these lifestyle illnesses that many of us struggle with, and they're not that easy to shift the dial on. But what was really interesting is that when I asked Diana how many times this story went into her mind about things being boring, tedious, and meaningless, she said, too many times to count, Gail. Comes into my mind all day long. The story that her mind had glommed onto. I'm going to come back to Diana. Let me for now go to a second individual who I also talk about in this chapter in the Mindful MD book, a physician that I call Isaiah, an emergency room physician, very well respected, like Diana, top of his game. But unfortunately, he was named in a lawsuit about a patient who'd come in with abdominal pain. There had been a misreading of the CT or whichever imaging study it was, and that had led to a surgical procedure that had some complications. So, well, who did they name in a lawsuit? Well, they name everybody they can find. So Isaiah was named. Something very frightening to happen in the career of a physician, right? Some of us, our worst fear, being named in a malpractice suit. But Isaiah hadn't done anything wrong. And yet, it led to a lot of fear, a lot of sleepless nights. He began to worry about what was going to happen in this suit. His mind went to the worst case scenario. He pictured being on the stand and being, interrogated by a punishing attorney. He pictured his face being on the front page of his local newspaper. He was so stressed out, he started yelling at the new puppy that he and his family had gotten. And the story in his mind is that this was going to be awful. This was actually going to take him down. This was going to ruin his career. Now, again, none of us want to be named in a malpractice suit. I'm not in any way saying that this was easy, and I'm not saying he overreacted. What I am saying is that his mind got caught in a lot of stories about just how bad this was going to be. Was it going to be hard? Yes, no question about it. But the story took on such a catastrophic tone that it led to just an immense amount of stress for this busy emergency physician and dad. The third story is my own story, and I actually include this in the book as well, with some embarrassment, but I'll be honest. When my son, Davi, was a teenager, he started developing abdominal pain, and it turned out that he was diagnosed with Crohn's. He's doing great now. Many of you have met my son. He's active on Facebook and in other places. He's the picture of health. He's on medication that completely controls his disease. But at the time that he was diagnosed, my mind went to a lot of blame that somehow I had caused his Crohn's, that I hadn't fed him the right food, that I'd been so selfish and so busy with my academic career that I hadn't really spent time taking care of him, that I was a terrible mother, that other physician moms and dads would have taken better care of their kids. You can just hear kind of the knife in the heart. And yet this was a story that I told myself over and over and over. Now, as you hear these three stories, and maybe my story about, maternal true confession here, maybe my story sheds the most light on this, that it's easy when we hear someone else's story to see, just how kind of borderline ridiculous that story is. I didn't cause Davi's Crohn's. Sure, I could have been a better mom. I could have paid more attention to his diet. I could have done all kinds of things, just as any parent could chastise themselves that they could have done more. But I wasn't a terrible mom, and Crohn's is caused by a lot of different things, typically not because of maternal issues. So you can kind of see, this story that my mind just kind of was so seduced by, so captivated by, that I didn't even question it for a long time. So you may have stories of your own. You may have stories like Diana's, that your work is boring and tedious and meaningless. You may have stories like Isaiah's, that something horrible is going to happen. Something catastrophic, that you're going to be out on the street, that you're going to be the bag lady or the bag man or whatever that analogy is, And in my own story, you can hear all the anguish. Well, what do we do? What do we do about these stories? Well, first and foremost, we bring them into mindful awareness. This is what mindfulness is about. It's about observing what our mind is up to, taking it out of the shadowy recesses of this confined space between our two human ears and bringing it out into the light of day. I liken it in the book to making a diagnosis, diagnosing what your mind is up to, using your wonderful cognitive skills to take a look yourself at your own thoughts and stories and patterns. That's the first step, bringing things out into mindful awareness. Why? Because until we do that, we can't work with these stories. We can't work with unhelpful thoughts. So for Diana, we needed to slow things down and ask her, was that the truth? Was it really all boring, tedious, and meaningless? There were hard parts of her job. Many of our jobs become stale over time. We see a lot of bread and butter issues, whatever our specialty is. That's just the way it rolls as we move on in our lives as attendings. But when I pushed Diana to move beyond the story and I asked her to tell me about some things that had gone well with patients, some positive interactions, well, at first she paused. She couldn't think of anything. That story had so captured her, she couldn't see beyond it. But when I pushed her further to look back on the past week, she was able to tell me stories of times when patients had listened. And even if they didn't listen and they were non-compliant, because these lifestyle issues are very difficult for any patient to grapple with, she was able to be present with one patient in particular. And she could see, when she paused and moved out of the story, she could see how meaningful that interaction was, not just for the patient, but for Diana as well. So it wasn't all boring, tedious, and meaningless. So that's what we need to do. We need to bring the stories out into the light of day, and then we need to challenge them. My story, that I had caused Davi's Crohn's, that I was the worst mother, that any other physician, mom or dad, would have done better. That was a story that was very, very painful for me to carry. And it wasn't until I looked with mindful awareness at my own stories that I began to see that I could question the story. I could really question, is this really what caused this young person's Crohn's? Do I need to keep taunting myself with the story? Because we don't have to believe our stories. That's the beauty of mindfulness. We begin to become the observer of our thoughts and stories and patterns and foibles. And when we become the observer, we can begin to see these stories for what they are. They're just stories. They're just narratives that the mind has fabricated, trying to make sense out of all the complicated inputs it receives. That's all they are. We don't have to fall prey to our stories in the same way. So mindful awareness, bringing them out of the shadows into the light of day, into awareness, into mindful awareness. Why? Not just to be aware, but so we can regulate ourselves, so we can decide, is this story true? Do I need to keep fueling this story? Do I need to keep kind of adding evidence to it? You know, I mentioned the imposter syndrome earlier on in this talk, and I've mentioned it many times in the past. It's just a mental story that the mind gets seduced by. We begin to believe it. We collect data in a very subjective fashion that somehow, validates that we are an imposter. We're really a phony. But it's just a story. It's just a mental story. And each of us, each of you, has the autonomy to decide how much attention you're going to give any thought and any story that comes into your mind. When you bring your own stories into mindful awareness and you question their veracity, it's very empowering. It's a game changer. You realize you're the author of these stories. You're the author, and you can write a new ending, whatever the story is. You can look at what the kernel of truth is in the story and work on improving yourself, whatever it is. Okay, I could have been a better mother. I could cook more vegetables for my son, for example. I can learn from this story. But much of that story was completely untrue, and I didn't need to kind of buy it, hook, line, and sinker, as the expression goes. That's the autonomy that we can have. That's the empowerment that we can have. We can become the master of the mind rather than its captive. So that's the good news. You can read more about this way that mindfulness restores autonomy and cures burnout, and you can read about the 5 other ones, lots and lots of case examples. So I hope this can be helpful to you. This is the work, getting to know our own minds, questioning what our mind is telling us, realizing that we don't have to believe everything our mind produces. It's a wonderful feeling when you gain that mastery. And that's what I want for each and every one of you. So thank you so much for listening today. I hope this can be helpful. I really want to encourage you. Notice your own stories and question them. Wishing you much goodness and the clarity and calm that is available to you in all of your moments.